Went to break. The Premier was talking to us about your government's response to the scourge of corruption. What are your thoughts?
Yes, I was saying that I think we have introduced, in addition to improving our audit outcomes, we have introduced what we call the open tender systems, the DESRI, basically to make it very difficult for bribery and corruption to happen in our system of procurement. We open it up, we shine the light on it to make sure that there's public scrutiny. Anyone can walk into a place where decisions are made on tenders today in Gauteng and see how those decisions are made.
Some quarters have called for a complete overhaul of the tender system itself and find a different way of doing business with society.
Well, I don't know how you can completely not go out to have a process of buying. Government can never produce everything it needs. You have to buy, because that's what procurement is about. Yeah. It's about buying. The key issue is how do you ensure that that buying is open, it's fair, and it's in line with our transformation agenda, and there's no malfeasance in this process. That's what we have introduced in this province. Lastly, we have also appointed a panel of civil society activists in the anti-corruption scale, where they are now our watchdogs. Over 2 years, this panel of civil society leaders who are corruption busters has been working with us to ensure that every area of governance in Gauteng where there's corruption, we can focus on that and ensure that that is addressed.
Does the Gauteng government have any contracts with Bosasa?
Yesterday, I announced, Desri, that I have actually asked the civil society panel, as I did when there were issues about KPMG and others. I've asked them to review any contract that the provincial government has ever had. I've asked them to undertake this work. They're going to work with our provincial treasury to check which department in Gauteng has had a contract with Bosasa, and they will advise me and the executive council.
Because the immediate thought is something has to be done to go in and provide the service where they're coming out. Because
our provincial treasury is actually...
They've declared a voluntary liquidation.
Our provincial treasury is acting even with more agency out of this liquidation issue. But I'm confident that we will get a decision made very soon. But first we need to know which contracts were ever entered into with Bosasa. What work did they do? What has been the result of that work before we take the next step?
You, as I said when I started the conversation, that you were very elated in terms of being the leader, in terms of jobs and education. The big story in Gauteng has been health, as a result coming out of the Esidimeni story, Life Esidimeni story. Where are we in terms of that particular chapter, unfortunate chapter of the Gauteng government health department story?
Okay, on the Life Esidimeni, I have yesterday given an update that when we didn't want to put anything under the carpet. Once the report came from the health ombuds, we acted on every part of those recommendations.
Yes.
We acted on those recommendations. I appointed, together with Minister Mtswaledi, Justice Dikgang Moseneke. He went through a painstaking and painful process. He ordered us to pay the affected families. We did that with the first category of all the affected families. We paid in June last year. There was a second category of those who came forward after the award was given. Those are the ones we have been working with the Office of the Master of the High Court to just make sure that they are paid and the right beneficiaries or claimants are paid in those families. And the Office of the High Court the Master of the High Court is very strict about those processes. So finally, we will be able to settle that as well. But go back to the big issue about healthcare. The healthcare system in Gauteng province faces major challenges. And I believe that it is not only here, but we have the biggest challenge. 20 million people from not just South Africa, the SADC region, use our healthcare facilities in this province. That's 3 times what the healthcare system coped with in 1994. the system is working fairly well at the level of primary health care.
Yeah.
We have 75% of our clinics that comply with national standards. This is done as they are assessed every 2 years. They do fairly well. They start on time, they open on time, they are managed fairly well. From time to there's medicines there, sometimes problem here and there, and they are closer. They are within 5-kilometer radius of where people live. But we have another part of the healthcare system, which are the hospitals. And that's where the big problems are with the hospitals. And I know we are paying a lot of attention to turning these hospitals around. Some of them are central hospitals. They are basically national hospitals, which we want them to be managed at a national level because they service the whole republic.
Yeah.
So that Gauteng province can remain just managing the provincial and district hospitals in the province. And that's where the turnaround, the next big turnaround has to happen there. If you ask me, I'm not satisfied myself with the healthcare system as it is because residents tell me that all the time they're not happy with the services. So that's the next big thing I would say. We're paying attention to it. We want to make sure the healthcare system is run by competent people, qualified people, including at the level of MECs. I now have Dr. Gwen Ramokhupa, and I can tell you that even the next MEC will be a doctor. We're not going to compromise on that. We want to appoint at the very senior level professionals who understand the system. But we also want a partnership with the private sector.
Yeah.
The private sector services
important.
a small number, but it has got huge capabilities. In this province, a partnership with the private sector in delivering quality healthcare is going to be important. And lastly, we want a partnership with our universities.
What sort of conversations are you having with the private healthcare provision system? They're charging such exorbitant amounts for access to healthcare.
It is true. It is true. I mean, the whole conversation about the NHI is about that even those who have medical aid.
It used to be that the law was inaccessible. You needed to have money to have access to the law. Now it's health.
Even those with medical aid will tell you, I check that myself. Even those with medical aid, they check that they pay too much. And that's why the conversation, getting the NHI in and for it to begin to happen so that there's quality health, access to quality health care to all is an important issue. But doing that is one thing, but from where I sit, we are also fixing the actual system as we have it now. And that's why in this province we are also working with our national Department of Health to increase the employment of nurses. The president has just allocated
Have you sorted
more
out the
resources
issue about the training of
with
nurses?
with what's called the stimulus package and the recovery plan. We will get more health specialists. We will get, including nurses. We will put more qualified people where it matters most for us to get things going with our health system, because healthcare is very important. As we are sorting out the economy, as we are sorting out education, we must sort out healthcare, and we must deal with issues of crime, which is also those four issues. If you add housing into it, they are the key issues that this administration has been focusing on. That's jobs, crime, education, healthcare, and getting the whole economy to focus on the future is what we have been paying attention to.
Let's talk about some of your promises in terms of economic development. You spoke about a future commitment to building Centurion and making it the new gateway of Africa, hoping to build offices for the African Union and offices from the United Nations. Commitments have been made there in terms of business partners to work with government there. Two things for me. The first is there is a general conversation, especially in politics, that the African Union Parliament in Midrand needs to be closed down because it's draining the Gauteng economy. In the middle of a conversation like that, does it make sense to then start talking about building offices for the United Nations and for the African Union?
Well, let me start somewhere else, Desiree, about the key issue about our economy in the province is that there's no part of the province that will function unless we work together, unless the premier and the cabinet of the province, the mayors and their executive mayoral committees work together. So one of the issue of you are raising something that I raised 3 years ago about the African Union. It was a plan that the former mayor of Tshwane had about Centurion and the AU headquarters there at Centurion. It was a plan. It is fact that that plan was stopped when the new administration took over in Tshwane. But if you think of the African Union, I can't say the African Union drains resources from the provincial economy. Firstly, we're not funding any operations of the African Union as a provincial government.
All right, Premier, unfortunately, we need to wrap up. Just tell us about what constitutes that plan quickly, and perhaps the most important parts of the SOPA for you.
I think the big issue in this province is what I said, is that we need to turn Gauteng province into a single special economic zone. The whole province must evolve. What we call the Gauteng city region is evolving now. That's the next big thing. We will have a few special economic zones. We have the IDZ, what's called the Industrial Development Zone at OR Tambo, which links up with Springs. But we are bringing different parts of the province where we will start with special economic zones. But the idea is that the day Gauteng develops as a whole into a special economic zone, the number of jobs and the growth and the transformation in this economy and the modernization that we are doing in the township, small scale there, the impact would be huge on those. That's really the grand plan about Gauteng, to make Gauteng a single special economic zone. You know what it will do to attracting investment? We will attract 3 times the amount of investment we are attracting now from foreign investors. So we will create 3 times the number of jobs that we are creating now in this economy.
What does the future hold for David Makhura after May 8th?
We work on the basis that government and public representatives have 5 years. So, because we are a democratic country, we are not a dictatorship. If we were a dictatorship, I would say maybe in the next 10 years, I'll still be here. So in 5 years, if you take it as it comes. 5 years, you do your work, focus on your work. That's what we have done. That's what I have done to keep this province working, to do our best to ensure that there's clean governance.
You can tell us your ambitions.
Let me say, so we are going to the public, we are going to the electorate. Our future is in the hands of the electorate. That's what the consequence of being democratic means. If you ask me, do you still have energy to serve the people of Gauteng? I still have. Because we have started to turn this province around in a big way on big issues. But also we want to fix the healthcare system. We want to deal with crime. We want to multiply the impact of the work we have done in the townships amongst the youth, in education. We want to fix this place.
Thank you so much.
I still have the energy to do that. But the public and the electorate must decide.
David Makhura is the Premier of the Gauteng province. He was giving us reflections of his SOPA yesterday. Let's take a break.